What are the differences between pneumonia, flu, and cold? Imagine catching a cold and feeling a bit under the weather, but then suddenly experiencing a high fever and severe body aches. It can be confusing to tell these illnesses apart, but understanding their differences is important for proper care. The common cold, influenza, and pneumonia are all respiratory illnesses, but they vary greatly in cause, severity, symptoms, and treatment. The common cold is caused by many different viruses, such as rhinoviruses and coronaviruses. It usually develops gradually and affects the upper respiratory tract, which includes the nose and throat. Symptoms are mild and include a runny or stuffy nose, sneezing, sore or scratchy throat, and a mild cough. Fever and muscle aches are rare with a cold. Most colds resolve within about a week without needing medical treatment, and complications are uncommon. Influenza, or the flu, is caused specifically by influenza viruses. It tends to come on suddenly and hits harder than a cold. Typical flu symptoms include a high fever, often above 101 degrees Fahrenheit, that lasts for 3 to 4 days, a prominent headache, severe muscle aches, and fatigue that can last for 2 to 3 weeks. You might also experience a dry cough, sore throat, and nasal congestion. Because the flu can cause serious health problems, especially in the elderly, young children, or those with weakened immune systems, early diagnosis and sometimes antiviral medications are important. Pneumonia is a more serious infection that inflames the air sacs in one or both lungs. It can be caused by viruses, bacteria, or fungi. Pneumonia usually develops gradually and often presents with a high fever that can reach up to 105 degrees Fahrenheit. Symptoms include chest pain or discomfort, a cough that produces sputum which may be rust-colored or pus-filled, shortness of breath, and fatigue. Because pneumonia affects the lungs directly, it can be life-threatening if not treated promptly. Treatment depends on the cause, with antibiotics used for bacterial pneumonia and antivirals for viral cases. Looking at the key differences, colds are mild, caused by many viruses, and tend to be self-limiting. Flu is caused only by influenza viruses, comes on quickly, and can cause high fever, muscle aches, and fatigue. Pneumonia is more severe, involves the lungs directly, and can cause serious complications if not treated properly. The severity of symptoms and the potential for complications make it essential to seek medical advice if symptoms worsen or do not improve. Understanding these differences helps in recognizing when to see a healthcare professional. While colds usually just need rest and fluids, the flu might requiring antiviral medications if caught early. Pneumonia often needs antibiotics or antivirals and sometimes hospitalization, especially in vulnerable populations. Remember, individual experiences can vary, so always consult a healthcare provider for personalized advice. Accurate diagnosis and timely treatment are key to recovery and preventing complications.